let's move on, and it's a pleasure to introduce Professor Xu Yonghua, who is Chairman and Professor of the Department of Imaging and Interventional Radiology in Fudan University in Shanghai Clinical Research Center. Sorry?
Continue, please.
Yes, thanks. So he's a board member of the International Society of Minimally Invasive and Virtual Surgery, and associated chairman of the Ultrasonic Therapy and Bioeffects Committee of the Chinese Association of Ultrasound in Medicine and Engineering, and a permanent member of the Mini and Non-Invasive Medicine Committee of Chinese Medical Doctors Association, and involved with the Tumor Ablation Committee of the Shanghai Anti-Cancer Association. He's on the editorial board of the Journal of Interventional Radiology in China and the Chinese Journal of Ultrasound Medicine, and was a member of the European Society of Radiology and the Society of Interventional Radiology. So it's a great pleasure to introduce you, and I'll hand over to you, Professor Xu Yonghua.
Hi, David. Good morning. Look at my screen. Background is morning. My topic is MRI evaluation for Fox ultrasound ablation in treatment liver cancer and pancreatic cancer. I know the mechanism you guys already talk about, and I just show the movie, and it's pretty easy to. Oh, it will not works. Look like it works. Yeah, and from the point to point, and then become line, and line to line, become the slice, and slice to slice become the volume, and we try to completely ablate the tumor, and normally, oh, it works. And we try to increase the temperature is more than 60 degrees. And probably ultrasound cannot see the temperature is more than 60 degrees, but MR can do it. And we first use the MRI guide HIFU to do the uterine fibroids. I think it's 13 years ago, which is the first clinical trial in China for MRI guided HIFU to operate the tumor. So now you guys talk so much serious and the clinical trial. I try to show you sharing and real world of our experience and work. First case I'll show you, this is HCC, which is the tumor located at the right lobe. This guy is 6 years old, and the tumor is nearby I think nearby the vena cava, and the second hepatic portal is large one, and after HIFU we can look at it is almost complete ablated. It's cool. However, other radio frequency ablation can do it. The microwave can do it. Our advantage is non-invasive, so the patient can recover very quickly. And the second day they can discharge and go back to home. That's important. However, this one is a hepatic carcinoma, which is not so, fortunately, after twice tests, still there's the small portion of the necrosis of the tumor. And also this tumor is located difficult position, and nearby the vena cava and the portal vein, and the surgeon refused to resect this tumor because of the big risk. And also the 70 years old. And we try to use HIFU to ablate it. Unfortunately, it's not so successful. And we try to think about why we cannot ablate it like the case before, the case one. So we try to change the environment of the the tumor. Actually this is tumor texture. We believe the tumor texture will influence the ablation effect of HIFU. So we use the needle. Actually, this needle is very tiny. It's 12G needle. We call it is non-injured needle. And we inject the iodized oil to change the, the structure, change the texture of the tumor. And look at the CT scan, we can see a lot of the, the iodized oil located. And interesting that we, after that, we perform the HIFU. It's a lot of cavitation happen. But cavitation happen, that means we can see very clearly and under the the ultrasound skin. So look like the uterine fibrosis. If some of the the bright become covered all the tumor, that means we already ablated the tumor. So interesting thing that this case is metastatic lesions at the left lobe and the right lobe. And this case is after colon cancer surgery. It's a big one and actually look like it's more than 7-8 centimeters, and we can completely ablate it. But we not believe the CT scan. Some cases not like exactly true. Look at this is cases from the liver, metastasis from the ovarian cancer. The lesions located at the subcapsule. And after the HIFU, and we can see the ablation here. However, we also did the CT scan and cannot see anything. And also this lesion, we not ablated so very well, and CT scan look like pretty good. Actually, this is just like us after 1 day and 2 days after the HIFU. So we recommended and follow-up examination is MR scan, conscious MR scan. And this is hepatic metastasis from the colon cancer surgery. We have a lot of this kind of cases because so many, the cases after the colon cancer remove, resected. So this guy is a female, 60 years old, and we can see conscious enhanced MRI, and this is before the HIFU. After this ablated and the lesion shrink, and the same thing this one in the T2 weight imaging, and before HIFU and after HIFU. And after HIFU, we can look at is the wall. It's the chest wall and the abdominal wall. It's edema. This is the test of the ultrasound penetrate. This case is also hepatic metastasis from the pancreatic cancer. And this lesion is a small one, and the patient refused to go to surgery, and we can look at this ultrasound guide HIFU. It's very clear. So look at this one is liver here and the lesion over there, and after ablated, the HIFU ablated, and almost complete, necrosis. This Chanlang carcinoma cancer of the liver at the right lobe, and the big one, this is much malignant. And after we inject the iodized oil and then ablate almost complete ablate the tumor. It's pretty easy. Also look at this one, it's look at not so much edema on the path of the ultrasound. And another one is female and 80 years old, HCC on the right lobe, and this is before and after that it's complete. However, this in the edema is much than before. The good thing is the skin is fine, and this is also mass from the colon cancer surgery, and the lesion is located between the first and the second hepatic portal. It's nearby the portal vein and also vena cava. It's a difficult location for the surgery, and radiofrequency ablation, also micro ablation as well. And this is middle of, just after HIFU, and we can see all the the brightest in the echo, and this is liver, and this is lesion over there, almost complete ablated, and follow up of the MRI, conscious MRI, and this is the result pretty good. Same thing is this is located in the second hepatic portal, and it's also different case nearby the heart. Okay, also this one also nearby the heart, right? Okay, so we pretty easy heart over there here, and the symbol closer is heart. So look at this is lesion is very difficult, and nobody can treat it. Maybe only chemo, and we can ablate this the difficult location of the hepatic metastasis. This lesion also is difficult in the location. This is after ascending the colon cancer surgery, and the metastasis lesions over here, and we try to ablate. Although you look at this image, is pretty, much obvious, and but this ablate is so not so good, but it's fine. And we try to also this is location is difficult to inject the iodized oil, so we just perform the palliative treatment. So the patient will feel the pain. We try to use the IV anesthesis. It's pretty easy, and the patient can accept this. Patient just a little sleep after, the procedure is quick, recover very quickly. We use two kind of the medicine. This is propofol, and this one is the HCC portal vein tumor thrombosis over here, and also the right branches was invaded, and other surgeon did not like him, and also no other treatment procedure to do it. So we accept this patient and look at this is invaded, the right branch of the portal vein. And this is ultrasound image. You can see this portal vein and thrombosis over here, thrombus over here. We just direct hit at the focus, the thrombosis. And the good thing is thrombosis slumps disappeared and after 1 month of treatment. And look at all the the lesions disappear. We follow and for 15 months. Look, it's become normal. Actually, this patient is now survived 3 years. FP decrease 15 and the other the analysis we IV analysis we use the Pancreatic. It's very safe and also very effective, and the patient recovered very quickly. After the procedure, just like 5 minutes, they can recover, and the patient very happy for this kind of thing. This guy is after sigmoid colon cancer, surgery, and there's hepatic metastasis over here. And we treated as much high energy. Actually, we used 400 watt and 2 seconds to when the sonication and 1 second interval calling. And we can look at this almost completed. Is ablated. However, there's some of the bleeding look like. But this fine. This patient is fine. It does not feel so pain and so something during the procedure. And they discharged. He discharged next days. Until now, it's still no complication. This is, the hepatic metastasis also is after colon cancer surgery, and the patient, the lesion is located second hepatic portal. There's risk for the radiofrequency because it's the bleeding and the thrombus in the vena cava. So they try to refer to us and use HIFU. After HIFU, look like the vessels still keep intact, and the lesion almost completely ablated. And the lesion also very close to the heart. So it's good thing for HIFU to perform for the challenger cases. Since the radio frequency and the microwave and cannot do it, we can complete the procedure and complete the treatment. This is a bigger one and compared to the other patients, and we can look at this patients already has Barrett's syndrome, and they compress the invade the vena cava and invade the portal vein and in hepatic vein. And this is under ultrasound guide. This is the liver over here and the lesion over there. And we injected the dyes the oil and then shoot this sonication. And look at the bright, become bright. And this is after first the ultrasound ablation, focus ultrasound ablation, majority portion of the lesion completed, ablated. Still, there's some at the edge of the lesion, and there's residual tumor. And we perform the second one after 1 month, and the patient refused to underwent the MRI. The image becomes, I think, too much cost. Actually, we cannot left the good imagery, but the patient is very good. Also, we try to introduce some of the metastasis not so successful the treatment. This is before treatment, and we use the test and look at is lack of the blood supply, and we try to inject iodized oil and look at this is some of the oil deposit in the lesion, and the CT scan find that this is conscious over hit there, and after 1 month become large one. So we try to first use the HIFU to ablate the largest one at the left lobe, and this one is for second procedures. The patient feel pain relief and in a good situation after first ultrasound, guided focus ultrasound ablation surgery. Also, same thing, this one patient is pain in upper abdominal pain, and the patient is pancreatic cancers, which is already extensive metastasis in the liver. And we tried first ablate is the largest one and nearby the stomach and the small bowel. This is nearby the gastrointestinal tract. It's we afraid of injury the tract, and the ultrasound ablation, focus ultrasound ablation can avoid this risk. It's pretty good that we can keep it a safer age. And next one we can try to ablate other ones. This is actually palliative treatment. We try to reduce the tumor size and to increase life times, and also improve the quality of the life. This ones cannot do this intrahepatic, the neoplasm from the liver cancer, and the lesion is located in the abdominal cavity. And we try to use high intensity focus ultrasound with much high energy. Still look like edemas on the the right abdominal wall is becomes very thick. And after treatment, we can see it's only 100% in the portion of the lesion ablated. It's fine. We try to keep, the tumor size down. Second one, we can introduce the treatment of the pancreatic cancer. And this images we have performed the ultrasound guide. This is the aorta. This is celiac trunk, and this is tumor, pancreas tumor, and this is liver. So our colleague in the Shanghai, they saw this images. They think it's pretty good and it's easy to show the pancreas, structure and the tumor structure. And the same thing we can ablate the tumor from the point to line to slice and to volume. Okay, this patient's before treatment, which is pancreas head cancer, and we try to use this path of the ultrasound to penetrate in the skin. However, look at this, so many, the bowel and the stomach are also nearby. So we try to use some of the gel in the intake, and then can let this small bowel has some of the gel over here, and we use this path and penetrate it. Okay, it's fine. And after treatment, we can see the tumor, majority tumor is lack of blood supply. It look like it is less perfused. So sometimes we use the conscious ultrasound to monitor the ablated area. However, look like here is very clear, but most of the situation, I believe, conscious enhanced ultrasound cannot see very well. Only MRI image you can see. It's very clear ablating area. And this is before HIFU and after HIFU, you can see this ablating area is pretty good. And also the CA 199 indicates very quickly. So same thing is MRI. If we use the T1 with imaging and the T2 with imaging, and we can see the lesion, but we're not sure how much ablated percentage. But we use the conscious enhanced, we can see very well in the ablated area. And compare the CT scan, we will show it. And this is a CT scan. We can see the metal stent in the common bile duct, and we say clear. However, the MR, we cannot see it. This is the before the treatment, and we can see the tumor already invaded the vessels, and we after treatment, the vessels still keep intact, and the tumor already ablated. So this is before treatment, and this is pancreatic neck cancers after 2 months, and we see this ablated area, and the tumor shrink. So this slide, so I show you why we do not use CT scan for follow-up after HIFU treatment. This is advanced cancer at the pancreatic neck. And before HIFU, look at this is the tumor over there, and after treatment, we see not so very well. And MR, we see this is cleared ablation area. So we recommend the MR is better than CT for follow-up. This case, unfortunately, the patient died 10 days ago. The patient is almost treatment 1 year, is a big one. And after treatment, the tumor shrink and also ablation areas is become small. This pancreatic cancer is a very, very tough cancer. Even when treated very well from the imaging, however, the patient not feel pain, but exhaust for the body, because they always take some medicine, chemo, and become weak and weak. We cannot stop the give her the chemo, because they think the physician think which the comprehensive treatment. So that's, we do not know how to get a good approach for treatment the pancreatic cancer. Since from image, the tumors become almost ablated very well, and the size becomes small, the patient die. So this case, I think is Dr. Zhang Lian and with Dr. Milk, and performed in Germany, and the tumors look like has become smaller and ablated very well. However, I'm not sure that how long the patient survive. That's our question. We need to know not only improve the quality of life, also we want to know how much time will that patient survive. So as a whole, I think pancreatic cancer, we use the HIFU to treatment is feasible and treatment, it is effective and also safety. That's, we treated the pancreatic cancer and the liver cancer, there's no complication. Actually tell you that the complication is less than HIFU treatment uterine fibroids. In the year before, last year, we performed the first one, 5G back the remote control, is HIFU. That's, we think if we have the 5G everywhere, we can perform the remote surgery by HIFU. Thank you. Thank you for your attention.